8 habits to stop frequent urination at night. Nocturia. Waking up multiple times during the night to urinate is far more than just an inconvenience. This condition, known medically as nocturia, affects millions of adults worldwide and can significantly impact sleep quality, daily energy levels, and overall health. If you find yourself getting up 2 or more times per night to use the bathroom, you're experiencing a legitimate medical condition that deserves attention and effective management strategies. Nocturia becomes increasingly common with age, affecting up to 60% of adults over the age of 60. However, this condition isn't simply an inevitable part of aging. Understanding the underlying causes and implementing evidence-based lifestyle modifications can dramatically reduce nighttime urination frequency and restore quality sleep patterns. Today, we're going to explore 8 scientifically backed habits that can help you regain control over your nighttime bathroom visits. These strategies are based on current medical research and have been proven effective in clinical studies. Each habit we discuss targets specific physiological mechanisms that contribute to nocturia, from bladder capacity and hormone regulation to fluid balance and sleep architecture. Before we dive into these transformative habits, I want to encourage you to engage with this content. If you find this information helpful, please subscribe to stay updated on evidence-based health guidance, and share your own experiences with nocturia management in the comments section. Your insights could help others who are struggling with similar challenges. The first habit we need to address is strategic fluid timing, which forms the foundation of effective nocturia management. Most people don't realize that when you drink fluids is often more important than how much you drink. The kidneys process fluids at different rates throughout the day, and understanding this natural rhythm can significantly impact your nighttime urination patterns. Research published in the Journal of Urology demonstrates that consuming the majority of your daily fluid intake during the morning and early afternoon hours can reduce nocturia episodes by up to 40%. This occurs because kidney function naturally peaks during daytime hours when antidiuretic hormone levels are lower. During these periods, your body is more efficient at processing and eliminating excess fluids. The optimal fluid timing strategy involves consuming approximately 60% of your daily fluid intake before noon, 30% between noon and 6 p.m., and only 10% after 6 p.m. This doesn't mean you should restrict your total fluid intake, which could lead to dehydration and other health complications. Instead, you're redistributing when you consume fluids to work with your body's natural circadian rhythms. For most adults, this translates to drinking 16 to 20 ounces of water upon waking, continuing with regular hydration throughout the morning and early afternoon, then tapering off fluid consumption as evening approaches. However, you should still drink when thirsty and maintain adequate hydration for any medications that require fluid intake. The second critical habit involves understanding and managing dietary triggers that can exacerbate nocturia. Certain foods and beverages have diuretic properties, meaning they increase urine production and can contribute to nighttime urination frequency. Caffeine is perhaps the most well-known culprit, but its effects on nocturia are more complex than many people realize. Caffeine blocks adenosine receptors in the kidneys, which normally help regulate fluid retention. This blocking action increases urine production and can persist for 6 to 8 hours after consumption. Research from the American Journal of Medicine shows that consuming caffeine after 2 p.m. can increase nocturia episodes by an average of 35%. This effect is particularly pronounced in older adults, whose metabolism processes caffeine more slowly. Alcohol presents another significant challenge for nocturia management. While alcohol initially acts as a sedative, it actually disrupts normal sleep architecture and inhibits the production of antidiuretic hormone. This hormone normally helps your body retain water during sleep hours. When its production is suppressed by alcohol consumption, your kidneys continue producing urine at daytime rates throughout the night. The timing of alcohol consumption is crucial. Having alcoholic beverages with dinner or later in the evening can lead to peak diuretic effects occurring during your typical sleep hours. Studies indicate that alcohol consumed within 4 hours of bedtime can increase nocturia episodes by up to 50% compared to alcohol-free evenings. Spicy foods and artificial sweeteners also deserve attention in nocturia management. Capsaicin, the compound that makes food spicy, can irritate the bladder lining and increase urgency sensations. Similarly, artificial sweeteners, particularly aspartame and saccharin, can act as bladder irritants in sensitive individuals. While not everyone experiences these effects, those with frequent nocturia may benefit from limiting these substances, especially in evening meals. The third habit focuses on bladder training techniques that can significantly improve nighttime urinary control. Your bladder is essentially a muscle that can be strengthened and retrained through specific exercises and behavioral modifications. Many people with nocturia have developed a pattern of responding immediately to every urge sensation, which can actually decrease bladder capacity over time. Bladder training involves gradually increasing the time between urination episodes during daytime hours. This process helps restore normal bladder capacity and reduces the frequency of urgency sensations. The technique begins with identifying your current voiding pattern through a bladder diary, then systematically extending the intervals between bathroom visits. The initial goal is to delay urination by 15 to 30 minutes when you first feel the urge. This isn't about ignoring your body's signals, but rather distinguishing between actual physiological need and habitual responses to minor sensations. Over time, as your bladder adapts to holding larger volumes, you can gradually increase these delay periods. Research from the International Urogynecological Association shows that consistent bladder training can reduce nocturia episodes by an average of 40 to 60% within 6 to 12 weeks. The key is consistency and patience, as bladder retraining is a gradual process that requires persistent effort. During the training process, you'll also learn to recognize the difference between true urgency and what medical professionals call false alarms. These are sensations that feel urgent but don't actually indicate a full bladder. Learning to identify and appropriately respond to these different signals is crucial for long-term nocturia management. The fourth habit involves optimizing your sleep environment and bedtime routine to support natural hormone production and reduce nighttime awakening. Your bedroom setup and pre-sleep activities have profound effects on the hormones that regulate fluid balance during sleep hours. Room temperature plays a crucial role in nocturia management. Research published in Sleep Medicine Reviews indicates that bedroom temperatures above 72 degrees Fahrenheit can increase nocturia episodes by disrupting the natural production of antidiuretic hormone. This hormone normally peaks during sleep hours and helps your body retain water, reducing urine production. The optimal bedroom temperature for nocturia reduction ranges between 65 and 68 degrees Fahrenheit. This cooler environment supports the natural circadian rhythm of antidiuretic hormone production and promotes deeper, more restorative sleep phases. Many people find that using breathable bedding materials and ensuring adequate ventilation helps maintain these optimal temperature ranges. Lighting exposure before bedtime also significantly impacts hormone regulation related to nocturia. Blue light from electronic devices can suppress melatonin production, which in turn affects the timing and intensity of antidiuretic hormone release. Creating a dimly lit environment for at least 1 hour before bedtime supports optimal hormone production patterns. The fifth habit centers on pelvic floor strengthening exercises, commonly known as Kegel exercises, which can dramatically improve bladder control and reduce nocturia frequency. The pelvic floor muscles support the bladder and play a crucial role in maintaining continence and controlling urinary urgency. Many adults, particularly those over 50, experience weakening of the pelvic floor muscles due to aging, childbirth, surgery, or prolonged sitting. This weakness can contribute to increased urinary frequency and urgency sensations that often worsen at night when hormone levels change. Proper pelvic floor exercises involve contracting the muscles you would use to stop urination midstream. The key is to tighten these muscles for 3 to 5 seconds, then relax for 3 to 5 seconds. This should be repeated 10 to 15 times per session, with 3 sessions performed daily. Research from the Journal of Women's Health demonstrates that consistent pelvic floor exercises can reduce nocturia episodes by up to 45% within 8 weeks of regular practice. The exercises are equally effective for both men and women, though men may require slightly longer to see significant improvements. The technique requires precise muscle identification and proper form. Many people initially contract their abdominal, buttock, or thigh muscles instead of the pelvic floor muscles. Learning to isolate and strengthen the correct muscle groups is essential for achieving optimal results in nocturia management. The sixth habit involves implementing targeted dietary modifications that support bladder health and reduce inflammatory processes that can contribute to nocturia. Certain nutrients and compounds have been scientifically proven to strengthen bladder function and reduce urinary frequency, particularly during nighttime hours. Magnesium plays a crucial role in muscle relaxation and nerve function, including the smooth muscles of the bladder. Research published in the European Journal of Clinical Nutrition shows that magnesium deficiency can increase bladder irritability and contribute to frequent urination. Adults with adequate magnesium levels experience significantly fewer nocturia episodes compared to those with deficiencies. The recommended daily intake of magnesium for nocturia management ranges from 300 to 400 milligrams, preferably obtained through dietary sources such as leafy green vegetables, nuts, seeds, and whole grains. Magnesium glycinate is often considered the most bioavailable supplemental form, as it's less likely to cause digestive upset compared to other magnesium compounds. Timing of magnesium intake can also influence its effectiveness for nocturia reduction. Taking magnesium supplements approximately 2 hours before bedtime can enhance muscle relaxation and support deeper sleep phases, potentially reducing the likelihood of awakening due to urinary urgency. Omega-3 fatty acids represent another important nutritional component for nocturia management. These essential fats help reduce inflammation throughout the body, including the bladder and urinary tract. Chronic inflammation can increase bladder sensitivity and contribute to frequent urination episodes. Studies from the American Journal of Clinical Nutrition demonstrate that adults consuming adequate omega-3 fatty acids experience reduced urinary frequency and improved bladder capacity. The anti-inflammatory properties of omega-3s help normalize bladder function and reduce the hypersensitivity that often accompanies nocturia. The optimal omega-3 intake for bladder health includes approximately 1,000 to 1,500 milligrams of combined EPA and DHA daily. Cold water fish such as salmon, mackerel, and sardines provide excellent sources of these fatty acids. For those who don't consume fish regularly, high-quality fish oil supplements or algae-based omega-3 products can provide similar benefits. Cranberry extract has long been associated with urinary tract health, but its role in nocturia management is more specific than many people realize. The proanthocyanidins in cranberry help prevent bacterial adhesion to bladder walls, reducing the risk of urinary tract infections that can worsen nocturia symptoms. However, cranberry's benefits for nocturia extend beyond infection prevention. Research indicates that cranberry compounds can also help normalize bladder pH levels and reduce inflammation in the urinary tract. This normalization can decrease bladder irritability and reduce the frequency of urgency sensations. The effective dosage for cranberry extract in nocturia management is typically between 500 and 1,000 milligrams daily, standardized to contain at least 15% proanthocyanidins. It's important to choose unsweetened cranberry products, as added sugars can actually worsen urinary symptoms in some individuals. The seventh habit focuses on stress management techniques that directly impact nocturia frequency through their effects on the nervous system and hormone regulation. Chronic stress activates the sympathetic nervous system, which can increase bladder sensitivity and disrupt normal urinary patterns. Cortisol, the primary stress hormone, has complex effects on fluid balance and kidney function. Elevated cortisol levels can interfere with the normal circadian rhythm of anti-diuretic hormone production, leading to increased nighttime urine production. Additionally, stress can cause muscle tension throughout the body, including the pelvic floor muscles that support bladder control. Meditation and mindfulness practices have been shown to significantly reduce nocturia frequency by promoting relaxation and normalizing stress hormone levels. Research from the Journal of Clinical Medicine indicates that adults who practice regular meditation experience up to a 30% reduction in nighttime urination episodes within 8 weeks of consistent practice. The most effective meditation techniques for nocturia management include progressive muscle relaxation, deep breathing exercises, and mindfulness meditation. These practices help activate the parasympathetic nervous system, which promotes relaxation and supports normal bladder function. A simple but effective technique involves spending 10 to 15 minutes before bedtime practicing deep diaphragmatic breathing. This involves inhaling slowly through the nose for 4 counts, holding the breath for 4 counts, then exhaling through the mouth for 6 counts. This pattern helps shift the nervous system into a more relaxed state conducive to quality sleep and reduced nocturia. Regular physical exercise also plays a crucial role in stress management and nocturia reduction. Exercise helps regulate stress hormones, improve circulation, and maintain healthy body weight, all of which can impact urinary frequency. However, the timing and intensity of exercise are important considerations for nocturia management. High-intensity exercise within 4 hours of bedtime can actually increase nocturia episodes by elevating stress hormones and core body temperature. Conversely, moderate exercise performed earlier in the day can improve sleep quality and reduce nighttime urination frequency. The eighth and final habit involves creating a comprehensive sleep hygiene routine that supports natural circadian rhythms and minimizes sleep disruptions that can contribute to nocturia. Sleep quality and urinary patterns are intimately connected, with poor sleep often exacerbating nocturia symptoms and vice versa. Sleep position can significantly impact nocturia frequency, particularly for individuals with sleep apnea or other breathing disorders. Sleeping on your back can worsen sleep apnea symptoms, leading to increased awakening and subsequent bathroom visits. Side sleeping, particularly on the left side, can improve airway patency and reduce the likelihood of sleep-related breathing disruptions. For those with lower extremity swelling or circulation issues, leg elevation during sleep can help reduce fluid retention that contributes to nighttime urine production. Elevating the legs 4 to 6 inches above heart level helps promote venous return and reduces the pooling of fluids in the lower extremities. The bedroom environment should be optimized for uninterrupted sleep to minimize the likelihood of awakening due to external factors. This includes maintaining consistent room temperature, minimizing noise disruptions, and ensuring adequate darkness. Even small improvements in sleep quality can have significant impacts on nocturia frequency. Consistent sleep and wake times help regulate the body's internal clock and support optimal hormone production patterns. Going to bed and waking up at the same time each day, even on weekends, helps maintain the natural circadian rhythm that governs anti-diuretic hormone release. The pre-sleep routine should begin approximately 1 hour before intended bedtime and include activities that promote relaxation and prepare the body for sleep. This might include gentle stretching, reading, or listening to calming music. Avoiding stimulating activities, intense discussions, or problem-solving during this time helps maintain the relaxed state necessary for quality sleep. Creating a bathroom schedule that includes a final visit immediately before getting into bed can help empty the bladder completely and reduce the likelihood of early awakening. This final voiding should be unhurried and complete, ensuring that the bladder is as empty as possible before sleep. It's important to understand that implementing these 8 habits requires patience and consistency. Nocturia often develops gradually over time, and reversing these patterns typically requires several weeks to months of consistent effort. Most people begin to notice improvements within 2 to 4 weeks of implementing these strategies, with maximum benefits typically achieved within 8 to 12 weeks. The key to success lies in implementing these habits systematically rather than attempting to change everything at once. Start with 1 or 2 habits that seem most relevant to your situation, then gradually incorporate additional strategies as the initial changes become routine. This approach is more sustainable and increases the likelihood of long-term success. Remember that nocturia can sometimes indicate underlying medical conditions that require professional evaluation. If you continue to experience frequent nighttime urination despite implementing these lifestyle modifications, or if you notice additional symptoms such as pain, blood in urine, or significant changes in urinary patterns, it's important to consult with a healthcare provider for proper evaluation and treatment. These evidence-based habits represent powerful tools for managing nocturia and improving sleep quality. By understanding the underlying mechanisms that contribute to nighttime urination and implementing targeted lifestyle modifications, most people can achieve significant improvements in their symptoms and overall quality of life. Your journey toward better sleep and reduced nocturia is unique, and what works best may vary from person to person. I encourage you to share your experiences with these strategies in the comments section, as your insights could help others facing similar challenges. If you found this comprehensive guide helpful, please consider subscribing for more evidence-based health information, and don't forget to like this video to help others discover these valuable strategies for managing nocturia naturally and effectively.